my name is Tiffany Smith, and I'll be discussing how secondhand smoke can lead to health risks in society. The reason this topic stood out to me is because I have a daughter who is asthmatic. And if she's exposed to cigarette smoke and she inhales it, it can cause her to have an asthma attack, and it will lead to us going to the hospital. Oftentimes, the cigarette smoke can not only affect the person who is smoking the cigarette, but others that are around them. It can affect them as far as developing respiratory infections or heart disease. It can also cause mortality. Studies have shown that environmental mortality has been researched on numerous occasions. Researchers have found upon their studies that this type of exposure can lead to cardiovascular risk. Oftentimes, the severity of the risk has a lot to do with the amount of exposure and the environment. Oftentimes, children and teens become exposed to secondhand smoke, which can put them at risk for developing long-term health risks. Researchers put together a study that focused on 4 different age groups, genders of the individuals in the study, and the ethnicity. Studies showed that children who were home experienced the lowest amount of exposure. Teens were next in line, and then adults showed the most exposure. Researchers also found that secondhand smoke exposure could lead to health risks such as heart disease, respiratory illness, and cancer in adults. Children are more prone to experience respiratory illnesses in the result of excessive exposure. When researchers tested smoke exposure based upon ethnicity, they found that Black individuals had the most exposure to secondhand smoke. Hispanics showed the least amount of exposure. Other studies show that secondhand smoke exposure can lead to cardiovascular illnesses. Oftentimes, individuals who experience more exposure have a higher risk of developing a cardiovascular disease. Based upon studies conducted, the risk of health disease may be the most crucial health risk that is derived from the exposure of cigarette smoke. Researchers also found that 34,000 deaths occurred in the United States because of this type of exposure. Secondhand smoke exposure can lead to environmental mortality. Researchers put together a meta-analysis to get the results showing the mortality rates. They discovered that 41,000 deaths among adults only were caused by secondhand smoke exposure. About 49,000 people in the United States have died because of the exposure. Based upon the research conducted, it was found that individuals who are exposed to secondhand smoke at a baseline level were more at risk for heart disease and mortality over the course of 4 years. They found that people who were not exposed in that time frame, the 4-year time frame, did not show any risk. Even though the risk diminished after the 4-year time frame, there still lays the people who are exposed for longer than that. This means that the longer a person is exposed to secondhand smoke, the more years that they are likely to be at risk of developing these diseases that can later on lead to mortality. It is very imperative that people eliminate smoking from their lives, because the risk that it has is not only on the person who is partaking in the cigarette smoke, but it's others who are also exposed. Our children are experiencing long-term illnesses such as respiratory illnesses or asthma or bronchitis because of the excessive exposure to the secondhand smoke. The mortality rate is rising as a result of this, and people are expiring at a young age. Not only the people that are exposed, but the people that partake in cigarette smoke. People have the freedom to do what they please, but they have to be considerate of who it affects around them. It is not fair that others are able to make a decision that affects society, the life of society as a whole, the life of our children, our teens, pregnant women, our elderly community. It's a long-going issue, and unfortunately, we can't eliminate cigarette smoke because unless we make it illegal, unless it becomes illegal. That's the only way that this epidemic or the mortality rate will decrease, that individuals will not be affected by the secondhand smoke exposure. Also, people can limit the amount of smoking that they do in public. Maybe put up more designated smoking areas so that people who are non-smokers will know, okay, let me not go in this area because this is designated for people who smoke. Everyone makes a decision in their life. If you choose to smoke, you choose to smoke. But unfortunately, people who don't want to smoke are also affected by this. And I think that we have to do better. Thanks. Bye-bye.